Hi friends, good morning and welcome to my channel Mukambika Nursing. Friends, here in this video we can see the questions from obstetrics and gynecology. And we will see today's question one by one. First question, a nurse is performing an assessment on a client who is at 38th week of gestation and notes that the fetal heart rate is 174 beats per minute. On the basis of this finding, the appropriate nursing action is to. And options are option A, notify the physician, option B, documents the finding, option C, check the mother's heart rate, and option D, tell the clients that the fetal heart rate is normal. Here we have to know the normal fetal heart rate. Then we can answer this question easily. The fetal heart rate depends on the gestational age. Okay. The fetal heart rate is 160 to 170 beats per minute in the first trimester. Okay. But it slows with fetal growth occurs. Okay. It become 120 to 160 beats per minute near or at term. Okay, if it is above this range or below this range, that is if it is above 170 or if it is below 120, we have to notify the physician immediately. Here option A, notify the physician, is the correct answer. Okay, remaining options are not related to immediate action. Okay, we have to take immediate action, that is document the finding, check the mother's heart rate, tell the mother client that the fetal heart rate is normal. We have to immediately notify the physician, that is the appropriate action. Here I have given the fetal heart rate range, that is the fetal heart rate is 160 to 170 beats per minute in the first trimester, but slows with fetal growth to 120 to 160 beat per minute near or at term. The physician must be notified if the fetal heart rate is outside these parameters. Next question, second question, the following which is a welcome sign of pregnancy. And options are option A, quickening, option B, lightening, option C, engagement, and option D, descent. Here the correct answer is option B. Lightening is the correct answer. Lightening is the welcome sign of pregnancy. That is the welcoming the baby. That is lightening is the welcome sign. And quickening means is the first perception of fetal movement by mother. That is quickening. It is occurs in the 16th to 20th week of gestation. This engagement and descent are the one of the order of movements that occurs during the labor. Here correct answer is option B, lightening. Question number 3. Signs and symptoms of placenta previa include. Options are option A, sharp abdominal pain, option B, painless vaginal bleeding, option C, uterus is rigid and hard, option D, all of this. Question is signs and symptoms of placenta previa, and correct answer here is option B, painless vaginal bleeding. Placenta previa means the bleeding occurs due to premature separation of abnormally situated placenta. Okay, that is placenta previa, and the bleeding in placenta previa is painless, causeless, recurrent, and bright red bleeding. Okay, that is the signs and symptom. Okay, painless, causeless, recurrent, and bright red bleeding. And usually fetal heart rate is present in this case, and hypertension is, or there is no increase in BP. The main thing in placenta previa we have to keep in mind is painless, causeless, recurrent, and bright red bleeding. Question number 4. Maternal complication during labor in placenta previa is. Options are option A, asphyxia, option B, birth injuries, option C, early rupture of membrane, and option D, all of this. Here question is maternal complication, not fetal. Maternal complication during labor in placenta previa is Early rupture of the membrane is correct answer. This asphyxia and birth injury all related to fetal complication. So here question, we have to focus in the question maternal complication. Option C is the correct answer. Question number 5. Volume of blood in mature placenta is about. And options are option A 500 ml, option B 350 ml, option C 1000 ml, option D 750 ml. And the correct answer is option A 500 ml is the volume of blood in mature placenta. Question number 6. The organic component present in amniotic fluid is. And options are option A proteins, option B lipid and glucose, option C urea and uric acid, and option D all of these. Question is the organic component present in the amniotic fluid, and the correct answer is option D. All of this is the correct answer. So protein, lipid, glucose, urea and uric acid all are present in the all are the organic compound which is present in the amniotic fluid. The main function of this amniotic fluid during pregnancy is it acts as a shock absorber, and also it helps to maintain the temperature, and it allows the free movement of the fetus, and during the time of labor it helps to dilation of the cervix, and it helps to flush the baby through the birth canal. These are all the some important functions of this amniotic fluid. Question number 7. The weight of uterus at term is. Options are option A 200 to 300 gram, option B 1900 to 1000 gram, option C 2 to 3 kg, option D 400 to 500 gram. And here the correct answer is option B 900 to 1000 gram. That is the correct answer. At term the weight of uterus is approximately 1000 gram. Okay, here option B is the correct answer. Question number 8. During pregnancy, the structure that acts as powerhouse of hormone is. And options are option A corpus luteum, option B placenta, option C uterus, and option D breast. Here correct answer is option B placenta. The main function of this placenta is to provide oxygen and nutrients for the growing fetus, and also it produces a lot of hormone during pregnancy which is necessary for the growth of fetus. So it is act as a or placenta it act as a powerhouse of hormone production. Option B. Question number 9. The value of HCG in blood reach at maximum between, and options are option A 10 to 30 days of pregnancy, option B 60 to 70 days of pregnancy, option C 4 to 5 months of pregnancy, and option D 4 to 5 days of pregnancy. A correct answer is option B 60 to 70 days of pregnancy. And the question is value of HCG in blood reaches at maximum between 60 to 70 days of pregnancy. Okay, here the HCG means human chorionic gonadotropin, is a hormone which is secreted by syncytial trophoblast of the placenta, and this value of this HCG in blood reaches between 60 to 70 days of reaches maximum between 60 to 70 days of pregnancy. Okay, and after that it start to fall or it start to decrease. The HCG start to decrease. Another one important point about this HCG is the half-life of HCG, human chorionic gonadotropin, is about 24 hours. That is also important point. Question number 10. Triple test in pregnancy include. Option A alpha fetoprotein, HCG and unconjugated estriol. Option B HCG, amniotic fluid and fetal blood. Option C alpha fetoprotein, HCG and amniotic fluid. Option D fetal blood, HCG and unconjugated estriol. And the correct answer is option A. The triple test in pregnancy include alpha fetoprotein, HCG and unconjugated estriol. Is the triple test is a combined biochemical test. Okay. The triple test is mainly done between the 16 to 18 weeks of pregnancy. Okay, and this is mainly helps for the detection of Down syndrome, not for the diagnostic. Only suggestive test for Down syndrome is triple test. For it helps in detection of Down syndrome, not a diagnostic test. Okay. Question number 11. Weight of non-pregnant uterus is. Options are option A 30 to 40 gram, option B 40 to 45 gram, option C 50 to 60 gram, option D 75 to 100 gram. Question is weight of non-pregnant uterus is, and the correct answer is option C 50 to 60 gram is the correct answer. Question number 12. During pregnancy, mother should take additional calories per day is. Options are option A 500 kilocalorie, option B 300 kilocalorie, option C 600 kilocalorie, and option D 1000 kilocalorie. And here the correct answer is option B 300 kilocalorie is the additional calories which should be taken during pregnancy by a mother. Okay, option B is the correct answer. Question number 13. During puerperium, mothers should take additional calories per day is. Option A 500 kilocalorie, option B 300 kilocalorie, option C 600 kilocalorie, and option D 1000 kilocalorie. And here the correct answer is option A 500 kilocalorie per day is the correct answer. During puerperium, mother should take additional kilocalorie of 500 kilocalorie per day is the correct answer, option A. Question number 14. Normal labor is known as. Option A eutosia, option B dystocia, option C delivery, and option D pasteurization. Here question is normal labor is also known as, and the correct answer is option A eutosia is also known as normal labor. And the next question. Question number 15. Abnormal labor is known as. And options are option A eutosia, option B dystocia, option C delivery, and option D pasteurization. So abnormal labor is also known as option B dystocia. Normal labor is known as eutosia, and abnormal labor is known as dystocia, and process of giving birth is known as pasteurization. That is option D is known as process of giving birth is known as pasteurization. Eutosia, dystocia, and pasteurization. Okay, here correct answer for this question is option B.